Why does preterm birth happen? Preterm birth occurs for a variety of reasons. Most preterm births happen spontaneously, but some are due to early induction of labor or cesarean birth, whether for medical or non-medical reasons. Common causes of preterm birth include multiple pregnancies, infections, and chronic conditions such as diabetes and high blood pressure. However, often no cause is identified. There could also be a genetic influence. Better understanding of the causes and mechanisms will advance the development of solutions to prevent preterm birth. More than 60% of preterm births occur in Africa and South Asia, but preterm birth is truly a global problem. In the lower-income countries, on average, 12% of babies are born too early compared with 9% in higher-income countries. Within countries, poorer families are at higher risk. There is some evidence that babies who were born prematurely tend to be shorter in childhood, but they usually catch up with those born at term and late adolescence, says Dr. José Derek, a senior research fellow at the Liggins Institute. Our study shows that women who were born very preterm fail to reach the stature you'd expect based on their parents' and siblings' heights. The research was done in collaboration with Uppsala University in Sweden using data from a large cohort of over 200,000 Swedish women collected from 1991 to 2001 to investigate the long-term effects of pregnancy. This is one of the very few studies that has specifically investigated the association between premature birth and adult height, says Dr. Derek. Also, we believe this is the first study to examine this association between adult siblings. Comparing siblings helped the researchers eliminate possible genetic effects on height difference. Earlier this year, the collaboration published research indicating that short women were more likely to give birth to premature babies, where women under 155 centimeters were twice as likely to have a premature baby than taller mothers. World Heart Organization has developed new guidelines with recommendations for improving outcomes of preterm births. This set of key interventions can improve the chances of survival and health outcomes for preterm infants. The guidelines include interventions provided to the mother, for example steroid injections before birth, antibiotics when her water breaks before the onset of labor, and magnesium sulfate to prevent future neurological impairment of the child, as well as interventions for the newborn baby, for example thermal care, feeding support, kangaroo mother care, safe oxygen use, and other treatments to help babies breathe more easily. A baby that was born at full term will begin to show signs of early communication at 2 months of age, when they discover their voice and begin to make cooing sounds. This is an exciting Milestones achievement. However, a premature baby born 2 months early may have only just mastered the suck swallow breathe milestone at 2 months old and can now take all of their milk by mouth. This is exciting too, but is more on track developmentally with that of a full-term newborn. Since every baby is different, and their journeys will vary from just a few days to many months, it's difficult to say when your baby will hit all their milestones and be ready for discharge. Keep track of your baby's progress by starting a journal or checklist and celebrating these milestones as they happen.